Good morning and happy Monday. I am Amanda Ignat, and today I'm going to be talking about midwife versus traditional birth attendant. So, for those of you who are new to my channel or new to my group, I am Amanda Ignat, and I am passionate about empowering women to believe in their ability to birth their children, to recover and heal from traumas from past birth experiences, and to just pull back their power from those situations and believe in their ability to go on and birth their babies the way their body was created to. So let's get to it. Midwife versus traditional birth attendant. So some of you might be asking yourself, what in the heck is a midwife? Well, for most people, we think of a midwife as somebody who is trained in natural birth, somebody who is confident in supporting natural birth. And unfortunately, today, what we have is we do have midwives who are those people. I myself have had them. They believe in physiological birth. They support women in that natural process. But then we have this other category that carry the name of a midwife, but they are midwives. And the reason we call them midwives is because they have trained heavily under the same obstetric vision as your OBGYN, and they work under the same premise, which means they're going to be requiring the same tests, the same procedures, the same scans, whatever it may be. They're more than likely going to be requiring the same things that you would be required to do at your OBGYN. So you're looking at the same amount of appointments, the same amount of interventions, the same amount of limitations if anything arises in your care. And so what that means is they're not as well versed in natural birth and the physiological birth process as your midwife, who truly does believe in and has experience for herself natural birth and who is willing to sit in that space with you. So you'll find midwives in hospitals, you'll find midwives in birthing centers. And you'll even find some midwives who are doing home births, but you'll notice where there's some uncertainty, where they're like, no, you have to do this. And they're telling you what you have to do to meet their level, to meet their satisfaction, which also means that you can test out for them, basically meaning that they have certain things that you have to meet throughout your care. And if you don't meet them, they're going to drop you and they will not refund you their money. The money that you've paid already will be lost. So keep that in mind when you're looking at a midwife. Keep in mind, what are they telling you that they absolutely will not waver on? Do you have the choice in your ultimate care? Because let's get into a traditional birth attendant. Traditional birth attendant is going to give you the liberty and the freedom to choose your care. If you don't want to go get your gestational diabetes test, that's up to you. If you're feeling fine, that's up to you. They will teach you to do your own prenatal care. So that means that they're giving you more control over your pregnancy and your childbirth experience than you will get anywhere else. They will hold space for you. They will give you, they will help you educate yourself. So if you have any concerns about this, they will help educate you in the areas where you have concerns so that you now have knowledge in place of fear. Because when you have knowledge, fear doesn't have a place to pick at you, if you will. So a traditional birth attendant is going to allow you to choose what you want throughout your care. you don't want to get ultrasounds, then don't get ultrasounds. Unless there becomes an issue that you are concerned about, they won't even recommend anything. Right? It's when you voice a concern, bring something up, that they will then present you with your options, what you can do to get answers that might settle your mind. They place all of the power in your hands, which is where it should be. It should always be in your hands. It is your body. It is your pregnancy. It is your childbirth experience. And when you live in that place of control, you are able to manage it much better than you would if you're under the pressure of care that is pushed on you, that you have to go through, that you have to meet these standards, because we are all built differently. And the way our medical system and the way that whole care process is set up is to look for issues. It's not there to help you. It's there to look for issues for them to control. Okay. So with a traditional birth attendant, you're going to get the freedom to choose for you. You're going to gain knowledge along your own journey because you're going to be doing things for yourself. And your traditional birth attendant is going to sit with you they'll be the calm in the storm of your childbirth experience. They're going to be the person just sitting back and watching and paying attention. And they're going to be learning from your experience while they're there supporting you. If you ask for support, they will be there to give that support, but they're not going to be requiring cervical checks. They're not going to be monitoring your baby every 5 minutes. They're not going to be like pushing any kind of stress on you. And that, my friend, is where you will be able to sit in your birth experience, allow it to unfold with calm, without anybody pushing any kind of anything on you, which allows your body to go through its natural physiological process and have the best outcome that you can. I do want to say that traditional birth attendants have the experience of being like they've had their own natural physiological birth experiences, or they've witnessed them on a multitude, and they've sought out the knowledge to be able to support women on this journey. And most cases, it's because of an experience they had or an experience they heard about that pushed them to see what their other options were in their pregnancy and birth experiences. So I hope you found this helpful. If you're watching this in my group, thank you so much for being here. I appreciate you so much, and I hope that you found this information helpful for you on your journey. And if you're watching this on YouTube, thank you so much for watching. Make sure you hit the subscribe and hit the bell so that you get notified when I am going live. And if you're not in my group already, my group is Open-Minded and Empowered Birthing Mamas on Facebook. You can jump in anytime if this was something that spoke to you and you would like to learn more about your abilities and your journey through pregnancy and childbirth. I try to give information on all 3 trimesters and even cover some fertility stuff. So let's get together. I'll talk to you soon.